Hey, Facebook Live. How y'all doing? It's Dr. Zarina. I'm going to give everybody a chance to come on in and join me. It is 4 p.m. and we have a conversation to have today. I am Dr. Zarina, also known as Dr. Z, your sports medicine and integrative medicine specialist, here to help you individuals rebound your health and obtain pain freedom through my different programs, consulting services soon to come, as well as my medical practice Rebound Integrative Medical Group through our Rebound Sports Rehab Division. I am Dr. Z, and as you know, had a couple of alerts. Going to be here to have some conversations today about shoulder pain. And so I want you to go ahead and click share. Go ahead and share a couple of down in the notifications below. You can reach me at any social media outlets at Dr. Zarina. That's DrZarinah. Hi everybody. Go ahead and click on, and as well as mainly, you'll get all of my live streaming through Facebook, and then afterwards, if you don't catch it live, don't worry. You can actually be able to upload it or find it on YouTube at Dr. Zarina, DrZarinah. Okay, so we're going to go ahead and get started in about 2 more minutes. Go ahead and let everybody know, share, so that they can come on in and actually maybe hopefully gain some information about shoulder pain, different solutions that are out there, because some of you for sure have come through my office or buzzed me on the phone or through my email, which I'll give you right now, with admin at Dr. Zarina. That's ADMIN at DrZarinah.com. And that's a way for you to reach me if you have questions about some of the topics I've discussed here already, or if you have some conversations about some topics that you would like me to discuss in the future. So that'll be what I'm here for, okay? So again, I'm going to go ahead and give you 1 more minute and go ahead and get it started. Hi, Keisha. Thanks for joining us. You're absolutely tips for life, pain-free. Absolutely. That's the goal here. And so my intention is here to, first, I'm going to overview a couple of things about some of the common causes of shoulder pain, as well as some solutions that we try to introduce at our Rebound Sports Rehab Department to help you obtain pain freedom, like we said, and rebound your health. Okay, so we're going to get started in about 30 seconds. Go ahead and click share if you can, so other people can come in and join us. Hopefully they may have some questions. And if they missed this live video, don't worry. Again, you can find it on Dr. Zarina, www.facebook.com/Dr. Zarina. Or you can also find it on my YouTube channel at Dr. Zarina as well. Just kind of Google that in the search box and you'll find me. So getting started, one of the most common causes of shoulder pain, believe it or not, is repetitive issues, and not necessarily from the actual injury. Although we have traumatic and non-traumatic is how we describe it, or how we delineate that in the medical field. And often, of course, I do have many patients who are obviously sports-related issues. So they do come into me sometimes because of a sports-related injury, and that repetitive issues coming back as far as their shoulder pain. But many of you actually come to me not because you're an athlete, but because you're a mom. Not because you're an athlete, but because you're a teacher, or you're a nurse, or you do a lot of lifting because of your job, be a truck driver doing a lot of lifting for those kind of things. And shoulder pain becomes an issue, not because it was a specific injury, like I said, but of repetitive issues. And that's probably the most common thing. The other thing I want you to know, so that you have confidence about that you can get better and you can obtain pain freedom, is that 90% of shoulder pain is actually treatable without surgery. And that's extremely important for you to understand that. Sometimes I think a lot of my patients, by the time they come to see me, they're at their wits' end. And it's not because, often it's because they actually ignored it, thinking they were afraid to go to see the doctor because they're going to recommend surgery. And that's not necessarily true. And a lot of times, if you don't wait too long, you could actually jump on it and obtain relief and get your functional mobility back in that shoulder a lot earlier than you actually did if you just kind of go in and bite the bullet and kind of get some information. I would say that most physicians, including your family medicine practice, physician, actually can help you with some of the conservative treatments as it relates to shoulder pain. Oftentimes they'll do an examination. They may or may not do a plus or minus x-ray to identify if there's any structural issues from a bony abnormality standpoint that may be the cause of that shoulder pain. And if it is, then of course, oftentimes they are going to recommend you out to a specialist like myself, or possibly an orthopedic surgeon. People get afraid of that too, right? I'm actually not an orthopedic surgeon. I guess you can minimally invasive type of procedures that are non-surgical based. And I also do, of course, as y'all know, I'm an integrative medicine specialist, your integrative medicine specialist. So I'm going to also try to implement things that are going to be, that you're going to have to ingest internally. Food is medicine, namely through those kind of things, as well as some exercises, and sometimes in the form of injections. Okay. Sometimes you do need medications to kind of get you to a certain point, but I don't personally recommend oftentimes long-term medication use. And I definitely try to avoid opioids at all costs. Do I prescribe them? There are those rare occasions where they're absolutely necessary. Okay, they are necessary sometimes. But my goal is actually to try to prevent that stage of it. And some of you come to me already on the opioids, and that's completely fine as well. And I can either, because of what we're going to do together, again, right, you're the MVP, I'm going to help and assist and coach you through that. I can help you come off of the opioids or come down on the opioids. And some of you actually come to me because you're trying to get off the opioids. And so, Ms. Rashana, depends on, I'll have to do a full examination, but I'll kind of give you an overview exactly what I would do in that case. So if you came in, you had an old sports injury, of course, I want you to first point to me where it is. Where are you having the pain? Doesn't mean that that's the source of the actual issue, but I'm going to ask you, where is that pain? You're going to point to it. And then from there, I'm going to actually do a very thorough examination. I'm going to examine you above and below that knee area and I'm also going to go examine you from side to side, because that's going to give me a very, very comprehensive overview of what that knee issue really is and help me tease down and get to the root of the problem. The other thing is going to be very, very important in that treatment process, or me getting to the treatment plan, is the history. Do you remember an actual injury, specific time frame? Do you remember if it started gradual? Do you remember if it was a sudden onset of pain? Okay, so that's one of the questions I want to know. From there, we plus or minus. You may also come to me, Ms. Rashana, already with some images. And if you do have some images already, then I'm going to review those. I'm going to look at those. I'm going to want to see the physical CDs. A lot of you come to me with the reports, and that's fine, but I like to put my own eyes on it. As an expert in this area, I find that sometimes I do identify things on a CD that just wasn't necessarily mentioned on the MR report. Doesn't mean that the radiologist was wrong or necessarily missed something big, but I do like to, and I appreciate the subtleties that sometimes are missed. And so that's extremely important. The other thing I have is an ultrasound machine. So it's very common that Ms. Rashana, that I will put the ultrasound machine and take a look at that in the office so that I can do a dynamic study. Why is that important? Because a dynamic study allows me to move the knee joint in different planes so that I can see it right there in the office to identify if I do see some sort of disease that the MRI may have missed or the x-rays would have missed. Why would an MRI and x-ray miss something like that? The reason is because they're not considered dynamic studies. Those are static studies, meaning like they take a snapshot. You have to be still. You know how they always tell you, be still, don't move, don't breathe, essentially, right? We're going to take images. And the ultrasound is actually going to allow me to move your knee because I actually want to see the movement. And sometimes what I'll see is ligaments moving, tendons moving. I'll be able to appreciate if there's any fluid in the knee, different structures like that. Okay, so that was an awesome question, Rashana. That was an awesome question. Keisha, we're getting to my pain was recent. However, with expertise, I identified that my pain was an injury that has gradually progressed. Thanks, Dr. Z. Absolutely, you're totally welcome. Again, like I said, something just like that. Sometimes it's not, you don't have to be afraid to go to the doctor. Sometimes there's simple fixes, and that's hopefully what we're going to be introducing to you through a rebound sports and rehab. So getting to some solutions, some common, actually back up for 1 second, getting to furthering what we talked about as far as some common issues as far as, y'all asking me about knee, this is mostly about shoulder. That's completely fine. Threw me off a little bit, but that's fine. Those are questions that people have, and I want to be able to introduce that. But specifically about the shoulder, I said getting back to the shoulder, a lot of times it's very repetitive when it comes to that. And sometimes it's not necessarily a traumatic issue that caused the shoulder pain in the first place. And that's something that is very, very common. Like I said, 90% of people will get better or can do better with conservative type of measures without necessarily doing surgery. Sometimes there's a ligament issue in your shoulder. Sometimes there's a tendon issue in your shoulder. You all have heard of rotator cuff. People come out, I have a rotator cuff problem. I have a rotator cuff injury. And essentially what you're telling me is that it's either muscle, tendon, or the ligaments that's an issue in that shoulder area. And again, I will place the ultrasound probe in the office a lot of times to identify a dynamic motion of that shoulder to see. Maybe there's something clicking. Sometimes you have impingement, what they call impingement syndrome. So not only is my physical examination going to assist me with identifying what the true root issue is, the ultrasound can further assist me. I consider that part of the exam. To further assist me as well. And then from there, like I said, based on the history, the examination, any images that you've done or may or may not have done, or I may introduce, is going to be very, very helpful. I also want to know, what is your nutritional status? What are you doing? What is going in your body that is going to help, has been helping, or has been hindering your ability to heal properly? Last week, we talked a lot about vitamin D3 on one of our topics. That's extremely important. And this is one of those another examples of why vitamin D3 in particular comes into play of healing. And if you're not adequately have enough in your body, you're going to heal slower than you would have to, and just not optimizing that area. Okay, so I have a lot of baseball players have over use injuries because, of course, they're always throwing the ball. So that's very common. A lot of my teachers and nurses, in particular my nurses out there, right? You're pulling, you're picking up. A lot of you, unfortunately, are not using great posturing when you're doing it because you're just in emotion. You're just trying to do all your caring and healthcare right there in the moment, not really particularly paying attention to your shoulder, to your back, those kind of things. Those will put you in harm's way, of course, and put you at risk for injury. So that's another common cause of it. And then, of course, believe it or not, it's to my stay-at-home moms too. Always picking up those toddlers, again, not paying attention to their body posturing, and of course, ends up with shoulder injuries because you're pulling, kind of with, like I said, not really paying attention to your posturing. What's some other common things? We talked about impingement, right? That's one of them. We talked about traumatic and non-traumatic, so sometimes the ligament or cartilage or tendon. And one thing I would say that if you are a person that quote unquote has your shoulder come out of socket a lot, they have that conversation or always kind of being displaced. If that's fairly common for you, or you have really, really loose ligaments, so your shoulder is displaced quite a bit in your life, you definitely want to go see someone quickly and go to someone very soon, because that's an instability issue. And oftentimes, believe it or not, that actually does require some type of surgical intervention. And that's nothing to play with, because down the road, you have earlier onset of arthritis, pronounced pain that can take much, much longer to get better. Okay, so that's really, really important. And teachers. Yes, we just talked about teachers. Yes, ma'am. So absolutely. Teachers, my nurses, you all do a lot of that. The board writing, constantly at the computer, those things. And people think about computer writing or typing a lot, and they think about carpal tunnel, right? But believe it or not, shoulders too. The shoulder area holds a lot of stress, and we're not stretching during our day. So let me jump right to that. That's a good segue into treatment. Some conservative things that you can do right now, today or tomorrow morning. That's why I love doing these on Sundays, because it kind of gives you something geared up to how you can prepare and introduce some things into your week. So starting Monday morning, if you're someone who holds a lot of pain or stress or muscle tension in the shoulder area, this is actually technically not the shoulder. We actually consider this the shoulder, okay? Can you see me? This is the shoulder technically. This is actually our traps. But it does follow the shoulder girdle that comes posteriorly as well as anterior, okay? But one of the things that you can absolutely do is do some stretches. I will be posting this week. So for you guys who actually want to know what kind of stretches, Dr. Z, I can't quite demonstrate them in the position I am now, but I do want to help you guys out. So I will post some tips about some simple stretches that you can do right in the office. I want you to take a 3-minute break every hour. So you stand up from that computer. Talking to you, and you, anybody that can hear my voice right now. You're going to stand up from that computer. Hi, Zakia, thanks for joining us. You're going to stand up from your computer, stand up from your desk every hour. How you do that, the strategy is take your phone out, you pull it up. You know how now these phones these days, you can put like 10 alarms on there, probably more. What you're going to do is you're going to put an alarm on every hour during your workday, and it's going to say stretch. Put that in the notation as the memo. And then what you're going to do when it goes off is you're going to stand up and do it. And every hour for 2 minutes, you're going to do some stretches. And I'm going to post some stretches at the end of this today so that you can have some by Monday morning of some simple tips you can do for stretching that's going to relieve some of that tension and that pain in the shoulder area and the shoulder girdle starting Monday morning and beyond, okay? Those are some simple things that you can just introduce right now if you did nothing else different that will make a difference, okay? So the other things you can do is, again, we talked about food is medicine. If you're currently, I want you to choose 3 things. Actually, I'm going to give you 3 things, actually. I'm going to give you 3 things that you can be doing along with those stretches that are going to decrease the inflammation in your body, in turn, obviously, going to help with that pain because a lot of your issues when they're overuse can be inflammatory. Not all shoulder pain or any pain is necessarily inflammatory based, but you do have to prepare your body to not be so acidic and have too many oxidative properties in it. And some of the things that you need to do is be eating more things that have high antioxidants as well as has less inflammatory properties in them, such as cinnamon. Cinnamon, if you don't like cinnamon, this conversation is not for you. But cinnamon it has antioxidant properties as well as anti-inflammatory. Put that in your cereal. I don't care what cereal it is. Put that in your oatmeal. What type of cinnamon? On the shelf, this is another tip. On the shelf, most cinnamon is going to be Saigon. And if it doesn't say anything on it, like it doesn't say Saigon or Ceylon, then it's Saigon with the S, Saigon. That's not the one I actually want you to use. And the reason that is because it has some properties that some studies have shown, actually not just some, actually going quite a bit. If you do the research and you kind of check me, right, and Google some things, although Google's not the doctor, but if you kind of do some searching about Saigon versus Ceylon with the C, that's Ceylon, that's the better property cinnamon for you. So I want you to introduce Ceylon. It doesn't matter how much really, although I usually would say about a teaspoon and a half on your cereal or in your smoothie or on your oatmeal in the morning. Do that, and that's one thing that you can do. The second food medicine, right? Food is medicine. Second thing you can do is make sure you introduce vitamin D3, 5,000 to 6,000 international units a day. And then I also want you to get your levels checked. I want you to know your levels. You know how they talk about diabetes, know your levels, your A1C? I need you to know your D3 level, okay? So if you haven't had one checked and you don't know your level, get it done by your family physician or your primary care doctor. Know your level so that you know and you can, again, be the MVP of your health and identify what you need to do and what you don't need to do, okay? So that's number 2 thing that you can do that put in your mouth is going to help with that shoulder. And the third thing you can do, is omega-3s. Why? Is because that's very, very helpful for the blood circulation, as well as, again, anti-inflammatory, actually. So a lot of times that's going to help with our pain over time. This is not these instant things. I'm not so much about instant quick fixes, although I have a couple of things up my sleeve for that. But for sure, I'm interested, obviously, right, in your long-term success, and I want you to win long-term. Okay, so that's what that's about. So that was the 3 things that I want you to introduce right now. So we talked about stretches for solutions that I want you to be doing right now, and I gave you some strategies what to do. I also talked about 3 things I want you to introduce into your mouth, into your and I want you to ingest to help with your intake and help with that pain. Okay, and then some things we do in the office is certain things. We have homeopathic type of treatment plans that can be beneficial for some people. Many of those are plant-based and have minerals in them, and those can help with the pain. Sometimes we introduce that. Sometimes we do use those with the trigger point injections. And sometimes it's a trigger point that's causing some of the pain, referred pain. Sometimes your shoulder pain is actually not just shoulder. Sometimes shoulder pain is a root cause is coming from the neck. Sometimes their headaches are inducing a referred pain pattern. Sometimes it's coming from your elbow and it's referring pain to the shoulder. That's why I said a thorough examination in the history is so important. And I'm going to make sure that I give you that so that we can really get to the root cause. We're not messing around. Okay. You take omega-3s daily. Awesome job. You get a A+ at least on that. High five. Okay, good job. So that's definitely one of the things I want to make sure you understand about that. Shoulder pain is not always, the issue is not always the shoulder. So it's important that we kind of tease that out. And then also do regenerative injection therapies. It's one of the I think one of the medical community's best kept secrets. I really do believe that. Why? Because in medical school, we learn about the bones, the nerve, we learn about ligaments and cartilage and tendons. But it's a certain thing that's called enthesis. And that fancy word is just really about that area that from the bone to the tendon and where that meets and where that junction is, where there's a lot of actually poor blood supply. But we have blood supply in so many other areas of our body. But when we have an injury and we don't have a lot of blood flow to that area, then that creates potential for chronic issues and chronic pain in that area. Shoulder is one of the biggest areas that happens in around that rotator cuff area. So then the injury or the issue or the overuse injury doesn't quite heal itself properly, and that's where regenerative injection therapies come into play. It's not surgery. It's not even a steroid injection. It's an injection indeed. And people are used to getting, my doctor gave me a steroid injection and I'm good to go. I do steroid injection as well under the appropriate circumstances. But what regenerative injection therapies do is they help regenerate the actual area. So we're actually regenerating tissue and getting you improving the integrity of that tissue, improving as opposed to just decreasing inflammation or just decreasing pain. All of those are the byproducts of those regenerative injection therapies, decreasing pain and improving integrity. But we're going to improve the integrity, decrease your pain, and improve your function. Isn't that awesome? So that's what happens if you're a candidate for regenerative injection therapy. We also call it RIT, or you might have heard of PRP or Prolo or platelet-rich plasma. That's what I'm referring to, okay? A lot of your professional athletes have benefited from that. Some of them discuss it, some of them don't. But what I'm trying to do at Rebound Sports Rehab Division is bring that access to the regular people. And that's one of my biggest passions, to bring access to all of you, my MVPs, so that you can also rebound your health and you can also obtain pain freedom. Let me look at some questions down here. Does sleep positions contribute to shoulder pain? Absolutely. We talked a little bit about that earlier, about positioning and how we don't use the best posturing. And sometimes, of course, you can't control how you're sleeping, right? But you do have to be cognizant of, are you one of those people that sleep in your chair? Are you one of those people that sleep in your recliner? Are you one of those people that fall asleep on the couch and don't get up until 3 or 4 o'clock in the morning? Actually, I'm going to raise my hand because I have done that. And actually, I think I did that last night. And I have a little pain, but I'm going to take care of that when we get off this video conference here. This stride streaming here. But absolutely, sleeping position can help. So I do recommend that you sleep in a bed. Have what you want to try to do is at least fall asleep in the most neutral position as possible. So you don't want to be all crunked up or whatever. No, sometimes some people are belly sleepers, some people are back sleepers. I'm not going to dictate to you about that part of it, but I do want to say that you need to get in the bed, and a slightly firm bed is best. Not too soft, not too hard. A slightly firm bed is best. So that's a great question. Does this help with arthritis? Yes. Arthritis is one of those things that we all, or many of us, most of us, will actually encounter at some point in our life. But that doesn't mean we have to be doomed to it. That doesn't mean it has to consume our life. So yes, those 3 things that I talked about that you can introduce into your body, as food is medicine, the vitamin D3, the omega-3s, as well as the cinnamon, things like that. Yes, those can help with arthritic pain. Turmeric, we didn't talk about that today, but I can talk about it a little bit later on why turmeric is so powerful for many people. But yes, that can help with arthritic pain. The stretches, yes, can help with arthritic pain. You have to move. Motion is life. Blood is life. Blood flow is life. Movement is life. So you ever notice, thank you for the question, Roberta, you never notice that when you first initiate a motion, in particular when it comes to arthritic pain, is that when it hurts the most. But then the more you move, the less the pain is, right? That's the indicative sign of the arthritic pain. And the reason, as we just said, the motion improves it. So absolutely. All those tips I just said absolutely can help with arthritic pain. So that was a great question. What do you do with neuropathy pain? Thank you for that question too, Ms. Gloria. Neuropathy pain, I want to kind of be able to give you more about that when it comes to neuropathy. So I want to do a video, and thanks for that question. So maybe I'll put that on my list for sure to discuss neuropathic pain. But sometimes, just to give you a touch about when it comes to shoulder, Sometimes neuropathic pain is the cause of people's shoulder pain, and they don't realize it. Because sometimes you have a pain that's radiating down the arm, and that could be a sign of neuropathic pain. Oftentimes, if that's the case, it actually is coming from the neck and not the shoulder. And that's something that we'll be able to tease out with our comprehensive examination and our history. So that's a great question too. And I can go into more detail about neuropathic pain and some issues and treatment plans for that are non-medication based, okay, in a different video. But thanks for that, and please tune in and share so that you can be alerted to when we have that conversation, and I would love to actually answer more questions about that. Okay, any more questions about the shoulder pain? So we discussed common causes, right? We discussed the traumatic and non-traumatic issues, right? We talked about food is medicine and things that you can do to help with that shoulder pain. We talked about some stretches, and we also talked about some treatment options that we have in the office. Those that include homeopathic type of plant injections or homeopathic treatments. We also have some regenerative injection therapy, which is non-surgical, but helps regenerate the tissue to actually improve it long-term and not just decreasing the pain for a minute or two, right? We also do certain specific exercises that are very tailored to you specifically, because one size does not fit all, right? I can't necessarily give the same exercise regimen to person A as I do person B, because it doesn't fit. And that's something that I take pride in as well. And I think that's what brings my patients coming back, is I am a strategist at the end of the day. I help you strategize for your life to bring you full recovery, to rebound your health fully so that you're in the driver's seat as the MVP and that you can truly obtain pain freedom. And I always like to define what I mean by pain freedom. Do I mean that you'll be pain-free forever? No, because we're human beings and we're going to experience pain. Pain freedom means that you are free from it consuming your life. That's what this is about. And again, that's what I'm here to help you bring it to that space where you can truly have pain freedom and that you can help ultimately rebound your health. Let me take maybe one or two more questions, and I'm going to sign off until, let me see, how do you incorporate Eastern and Western medicine when you're dealing with shoulder pain? That's a great question. And that's kind of, you notice, the kind of blend of my conversation here has been just that. I use traditional medicine as well as, I guess you could say, Eastern medicine or non-traditional medicine, because one size doesn't fit all. That is exactly the point. I have to meet you where you are, but I want to take you beyond where you think you can go. That's really what my goal and my passion is about. So through my training, I did traditional medicine training as well as non-traditional training. And I want to meet you where you are in terms of your value system, as well as the things that are going to be most beneficial to you. So I'm not going to recommend something that is not appropriate and just because I know how to do it. No, it has to be uniquely appropriate for you and what your issues are. Okay, so that was a great question, Mrs. Shouler. Very, very great question, Dr. Mickey Williams. All right. So again, I am going to sign off now. Those are great questions. I hope some of you can go back and review this video so that you can obtain some information that you might have missed during the beginning. Please click notifications below so that you can be alerted. So when I'm coming on, it'll kind of just pop up. Go ahead and share this video if you don't mind. If I maybe can benefit someone else that didn't get to see the video, I will try to upload this to YouTube. And don't forget, you can check sometime between now and 8 a.m. Some tips about those stretches so you can get a visualization of the type of stretches that you need to be doing in the office. Set your alarms right now, okay? Give me 7 alarms on your phone, and it's going to go off every hour. And every hour you're going to stop for 2 minutes, and you're going to do these stretches, right? Right? Right, Ms. Nakia? Right, Jamila? Right, Ashara? We're going to do those stretches every hour. So make sure that we're going to rebound our health, right, and obtain our pain freedom. So that's one of the things we can do. And also the treatment options that's in the office. Sometimes it's not enough. That's true, right? Sometimes we're doing the stretches, we're doing all the food is medicine stuff. I get that all the time. I did all that, Dr. Z. I did all that, and I still have pain. Come see me, okay? Come see me. You can reach us at www.rim-group.org. You can also reach me on Facebook at www.facebook.com/Dr. Zarina, or you can reach us at 678-902-4776. Also says 678-902-4RIM. That's 4 RIM. Okay, so either way, try to get touch base, and if you can't quite catch me in Atlanta, because I know some of you are meeting me and reaching me through all over the country, you can definitely ask the questions. I can help direct you, but try to identify someone in your area that is going to truly give you the best. give you their best so that you can obtain your best. And that ultimately is rebound your health and obtain pain freedom. All of your MVPs, you're my MVPs. I love y'all for tuning in. I love y'all for watching. Again, try to keep up with me. I'm going to keep up with y'all. You can find me on any social media outlet, but definitely keep up with the live streams on facebook.com/Dr. Zarina. That's DRZARINAH. I am your sports medicine integrative medicine specialist, here to help you rebound your health and obtain your pain freedom through my various programs, consulting services soon to come, and our medical practice at Rebound Integrative Medical Group. Love y'all. Love y'all MVPs. See y'all next week.